Good afternoon and welcome to our session, How Important Are Vitamins and Minerals to ALS? My name is Bob Twasutin. I'm a care coordinator for the Long Island region, and I also play a liaison role to the Stony Brook ALS Clinic. The clinic has been one of our longest standing certified centers, 20 plus years, with a team of doctors, dietitians, PT, OT, speech therapists, social work, and other. We play a vital role to people on Long Island, as well as we have many people coming from outside of the New York City area to our clinic. Today, our topic is going to be how important vitamins and minerals are in ALS. The session will focus on the vitamin and mineral contributions of the diet of the patient with ALS, in addition to supplement of vitamin and minerals to overall good nutrition and treatments to be discussed. Our guest speaker today is Lorraine Donowski, PhD art registered dietitian. Lorraine has been with the Christopher Pendergrass ALS Clinic at Stony Brook for 20 plus years. She's been there since inception. She helped with the initial setup of the clinic and is proud to be an original member of the clinic. She has presented at many organizations for ALS at the ALSA. She's also contributed with the ALS United Greater New York chapter on feeding tubes, when you need them, how to be involved, and has done seminars with our national office. She's also presented at the Northeast ALS Consortium related to her doctoral work. Over the years, she's been providing nutritional care to our patients at the center. She's been has educated many dietetic interns, 16 each year, about nutritional issues of the ALS patient. She runs as part of our interdisciplinary team, a good model for patient care and education. She's also been interested in research and has been able to look into the function and structure of ALS treatment teams across the country for her doctoral work. She continues to work with our patients and families to provide the most up-to-date nutritional care possible. And we welcome Lorraine to our session today.
Thank you, Bob, for that wonderful introduction. And welcome everybody this morning to How Important Are Vitamins and Minerals in ALS. So I'm going to just share with you my screen so you can see my slides. Okay. I think I have to actually share first. I need to. Okay, so how important are vitamins and minerals in ALS? So I just wanted to give you some objectives, what we're going to be covering today. So I wanted to start off with what constitutes a balanced diet, and so you can see the role of vitamins and minerals and how they fit in. I'm going to cover vitamins, fat soluble and water soluble. I'm also going to cover what are minerals, and I'm going to go into which vitamins and minerals are so very important in ALS, not that all of them aren't important. And then there's some interesting research topics, including vitamins, that I just wanted to review with you as well. So I usually start all my presentations on nutrition, especially for ALS, is what are guidelines for good oral intake and how much do I need? So I usually break it down. Sometimes I do a menu, but what I want to show is the food groups and how much you would need to consume to maintain your weight, your nutritional status, your protein status, and so forth. And this is all based on your height, your weight, your age, and your activity factor, your actual calorie needs. So for the ALS patient, a lot of times we use 30 to 35 calories per kilogram as a guideline. If you're stable at your weight, you may require slightly less. But as time goes on and maybe some chewing or swallowing gets more difficult, or you have to rest a little bit during your meals, your needs may actually increase. So the first food group I'm going to talk about is very important, is meat or protein group, and you need 2 or more servings a day. So one example of one portion size would be 3 ounces of hamburger fish, or in some cases 2 cups of beans. Milk or yogurt should be 2 or more servings, and that would be either 8 ounces of milk or yogurt. The yogurt usually comes in smaller cups, but that would consider like a 5 ounce cup would be a serving for that. Fruits and vegetables would be 5 or more, maybe even closer to 6 or 7 or more. And what's considered one serving would be a half a cup of cooked or 1 cup of raw broccoli or other vegetable, one medium or half a cup of canned fruit, such as peaches, softer things like bananas, and a full banana would actually count as 2. We like things with a lot of antioxidants, so berries are a good choice. Trying to think of some other, berries usually my go-to, but other things like oranges also give vitamin C and other needed nutrients, along with some fiber. Grains and starch is probably the biggest variation there because we have maybe a small woman who's 6 servings of grain or starch would work for them, and then we have larger men where they may need 11 or even more. And 1 serving is a slice of bread, a half a cup of pasta, or a third of a cup of rice. And then fat. So fat's very important in the diet. Along with helping with absorption of fat-soluble vitamins, it also is a good contributor of calories. So that's also very important. And that would be between 4 and 7, and you can go higher than that. So a teaspoon of butter or olive oil is a serving, or a tablespoon of cream cheese would be a serving. An eighth of a large avocado is a serving. And those are the healthier fats. But I also, a lot of times, suggest to my patients that they use whole milk because they'll be getting some calories from the fat. And you know, I am more worried about keeping weight on than so much other health conditions, although we try to address them as well. So what is the contribution of meat or protein to the diet as far as vitamin and mineral intake goes? So you can see here that we have B vitamins are contained in meat, vitamin E, iron, which is very important, zinc, magnesium, phosphorus, and selenium. And these vitamins, they're needed for building and repair of tissues and supporting energy production and also maintaining healthy blood cells. Next, we have milk or yogurt and their contribution to the diet. And it's many. So it's calcium, vitamin D, B12, B2, phosphorus, and potassium. And these vitamins and minerals play key roles really in bone and teeth. They help your immune function, energy metabolism, and also play a role in regulating blood pressure. So the other important component of milk or yogurt is that it also contains protein, which is what the previous slide talked about. And so a cup of milk will give you equal to what an ounce of protein would be, or what an egg would be. And a Greek-style yogurt, which people either like it or not, that gives you more protein, sometimes up to 12 grams of protein in that small cup of yogurt, compared to a non-Greek style one, which usually has a lot of sugar, and which is okay, but it just doesn't have the protein content. And so that's why if I'm encouraging people to make smoothies, I want them to get more protein and more nutritional value. So I do try to encourage the Greek style yogurt. Fruit and vegetables, what can you say? Vitamin C, vitamin A, folate, which is B9, potassium, magnesium, zinc, and phosphorus. Okay. And these give you fiber in the diet. They support the immune system. Vitamin A is needed for vision. And of course, folate is needed for cell growth. Next, we have grain or starch contribution to the diet. And that's where you get a lot of your B vitamins, or from the starch. You also get some iron, some magnesium, and some zinc. And what the grain or starch contribution to the diet is energy metabolism, nerve function, formation of red blood cells, and also zinc is important for wound healing. So next we have fat. So fat always gets a bad rap, but we use it a lot of times to give actually calories into the diet. So you can use the healthier fat calories if you want to, but they're very important to include in the diet, no matter what type of fat that you use. So they contribute to vitamin absorption, especially for the fat-soluble vitamins, which are A, D, E, and K. They're essential for absorption of some minerals. It also protects your organs, and it's also a storage form. And just one example is that fat is also optimally needed for calcium absorption. So that's very important for bone health. So I did break them down because I'm talking about vitamins, but I don't want to assume everybody knows, all the vitamins and what they do. So this just goes into some of the fat soluble vitamins. Um, and it's needed by the body in small amounts. And we get vitamins from plant and animal products and also some dietary supplements, especially when it starts to be that you may leave out a nutrient from your diet because it's too hard to chew or swallow. So vitamin A functions to maintain your skin integrity, as we said before, needed for vision, especially night vision. It regulates structure, function of membranes, aids with bone and teeth formation, and is active in all the immune system reactions. Vitamin D, and I'm going to talk about this one a little later too, promotes mineralization of bone by enhancing calcium absorption, increases resorption of calcium for bones and kidneys, and assists with normal serum levels of calcium and phosphorus. And the most biologically active form is D3. Just move this out of the way since it's kind of blocking some of my slide here. Okay. Vitamin E. So there was a lot of research with vitamin E for ALS, and there was, I guess, hope that as an antioxidant it would really prove to be valuable. And so I still think it functions as an antioxidant in a lot of cases, but over super supplementing that in our population hasn't really proven to do anything. It does protect cell membranes, red blood cells from oxidative damage by inactivating free radicals, which I'm going to go on to explain in another couple of slides. It spares vitamin A, and it protects your blood cells, and it aids in blood thinning and improves your immune response. Vitamin K it can be in 3 different forms called the quinones, and I have them there. I have phyloquinone, menaquinone, and menadione. And a lot of the vitamin K that we have, usually you don't have to supplement this, but it's actually formed by bacteria in your GI tract or in your gut. Okay, so don't let this list fool you. I'm going to try to go through it just a little bit quickly, but these are the water-soluble vitamins. And as you'll see there, you have your little lone vitamin C there, ascorbic acid, and then all the rest of them are B vitamins. But they're also important and play a role. So vitamin C or ascorbic acid enhances absorption of iron. It improves stability of folic acid. It helps cell functions, and it aids in collagen formation and wound healing. So that's a very important one. And those are things like your citrus fruits, and those really provide most of the vitamin C in the diet. Vitamin B1 is thiamine, and that regulates your GI tract. It's necessary for normal functioning of nerves, which is important. It's a coenzyme or a cofactor for carbohydrate metabolism, or how you process starches and grains. And it helps maintain your heart function. We have riboflavin, which activates B6, another important B vitamin, folate, niacin, and vitamin K. It maintains body tissue, forms red blood cells, and protects against skin and eye disorders. And then we have niacin, plays essential roles in metabolism, makes coenzymes responsible for energy production. B5 also required for energy production and hormone synthesis. B6 or pyridoxine. These coenzymes are required for amino acid metabolism, which are the building blocks of protein. So you need this for protein metabolism. So you're taking in more protein, you need some B6 so that you can body can actually use it. It helps form non-essential amino acids. So your body takes in a lot of different amino acids. Some are considered essential and needed to be taken with the diet outside of what the body can produce. And then the non-essential ones kind of get, we'll say, recycled so that you can use other spare parts to make some of the other amino acids you need. It helps with formation of neurotransmitters, immune function, and reduction of the risk for heart disease. B7, which is biotin, is involved in carbohydrate and fat metabolism, and I know a lot of people take this for healthy skin and nails. Folate, very important. It's critical to form RNA, which is needed for all cell processes and also for its role in protein synthesis. And also for DNA, which stores genetic material, okay? And it's very important for rapid cell turnover. And this is needed during pregnancy for women to prevent some birth defects that can happen. So folate is another very critical B vitamin. And cobalamin, we're going to talk about, and we're going to talk about the different forms of cobalamin. And that's required with folate to synthesize DNA and RNA. You need it for the myelin sheath synthesis, which is part of the nerve fibers, which protects them, fat and carbohydrate metabolism, normal blood cell maturation, and to maintain the active form of folic acid. So vitamin B12 requires intrinsic factor to be absorbed. And if you don't have that, pernicious anemia results. So if you don't have the intrinsic factor due to surgery or low stomach acid, or if someone's been a strict vegan vegetarian for a long time, they may not take in enough B12. So that's something that will be looked at. Okay. The next I'm going to talk about is the functions of minerals. And these are also very important in the body. So they help with cell structure, strengthen rigidity to hard surfaces like bones and teeth, regulatory functions, again, hormones and enzymes, cofactors, so that you have a mineral that unites with another compound so that a certain substance can be formed. And one important one would be something like iron is essential for hemoglobin to carry oxygen in the red blood cells, and also for enzymatic reactions in the body. Zinc for cofactor for DNA synthesis and needed in wound healing, transmission of nerve impulses, and also maintenance of acid-base balance. So here we go again with another big chart. So I don't know, I'm going to read this whole thing to you, but I just want to point out, again, some of the same ones keep coming up, but for calcium is needed for bones and teeth, muscle contraction. Phosphorus is also important. So to have a good, healthy bone, you need a certain ratio of calcium and phosphorus. Now, magnesium, I will point out, is very, very important because as you can see there, over 300 enzymes and nerve transmissions, and magnesium helps with that and other minerals. So that's involved in a lot of enzymes in the body. Now, sodium. Sodium and potassium is very often when you go to the doctor and they take some lab values, they will take sodium and potassium along with a few other things. And so what they're looking for is the balance. Is the sodium okay and the potassium? Because cells permeability, maintenance, muscle contraction, nerve impulses, acid base, and nutrient absorption is needed with a certain amount of sodium in the diet. And generally in America, we get enough sodium because we eat a lot of processed foods, but you do need a certain minimum amount in the diet. Potassium also is very important. It maintains your fluid balance, energy metabolism, acid-base balance, again, transmission of nerve impulses, and it regulates the heart muscle. So that's one that's kept in usually pretty tight requirements in the blood. We also have chloride and sulfur. Okay. We also have, so those are considered the macro minerals. We also have some micro minerals. So the macro minerals, the ones I just showed you, are required in larger amounts. So calcium is required in larger amounts. But some of the trace minerals or micro minerals are needed in very, very small amounts. And so I have them listed here. Some important ones are ones like iron that people hear about, iodine, zinc, selenium, chromium. And chromium is needed in some cases with people with blood sugar control issues because chromium helps. It's called the glucose tolerance factor. So you may have heard of that for that. And we also try to balance some things like copper and zinc. Usually if we supplement zinc, we also try to supplement some copper because they compete in the body. So you don't want to ever give a supplement and deplete something else. Okay, so why are vitamins and minerals, along with the fact, since they don't contribute calories to the diet in our patients, why do we care so much? But a lot of them function as antioxidants. And so this isn't a science lesson, but I did find some, antioxidant enzymes that sometimes people will have heard of, like superoxide dismutase, catalase peroxidase, and glutathione peroxidase. And for these enzyme systems to work, you need some of these minerals, such as zinc, copper, manganese, and selenium. And they form an antioxidant complex, which is needed in the body. Okay, so I said, as promised, I said I'd talk a little bit about vitamin D. So vitamin D is very important for bone health, for all RDAs, for all people. I gave the RDA for adults because that's the population I'm mainly talking to here, from ages 19 to 70, need about 600 international units in a day. Okay, and this is routinely tested for when you go to the doctor. Generally, they will take a vitamin D level, and this is for a lot of different neurological illnesses. We want to make sure that you're not vitamin D deficient. We also know that some of these neurological diseases may lead to loss of bone and mineral density due to physical inactivity and sometimes reduced muscle contractions. So having a healthy amount of vitamin D on board helps. ALS may lead to an increase in fractures due to the decrease in the bone density. And we also know that there's a risk of falls. So adequate vitamin D is essential for healthy bones. In addition, it does reduce oxidative stress and inflammation. So when I went to school, I was taught that all but B vitamins are water soluble, and they are, and that it's very hard to take too much of them because the body will flush them out. And that for the most part is true. But we do know that vitamin B6, and the reason I bring this up is because it is in supplements as well. It is a cofactor and you need it for a lot of different enzymatic reactions, but sometimes people can take too much. So it's not toxic by dietary means, but if you're taking a lot of supplements, if you're taking a multivitamin and then you're supplementing with something else, you may end up taking too much vitamin B6. And this we know is not good for our patients. So the upper tolerable limit for B6 is 100 milligrams a day. That's the maximum amount we want someone to take. But there is other research that recommends taking less is beneficial for our patients. All right. I'm also just looking at my time to make sure I'm doing okay as far as time goes. All right, so B12 or cobalamin. So I was lucky enough to attend a webinar by Dr. Bedlock, and I gave him credit for some of the materials that I got from this because he was explaining why vitamin D is so important for our patients. But then he went into some of the other things, and I also did a little research on my own so I could present some of this for you today. So vitamin B12 cobalamin helps keep blood and nerve cells functioning. It does make DNA, which is the genetic material found in all human cells. It prevents a specific type of anemia that makes people feel tired and weak. And we require about 2.4 micrograms a day. I gave you some of the food sources there. So meat, poultry, eggs, milk, clams. I didn't know that clams and oysters were such a good source. And also it's fortified in some things such as breakfast cereal. So if you're a very strict vegan, vegetarian, you may want to consider a fortified breakfast cereal to help you get your vitamin B12. It can be found as a supplement alone or in a B complex. And the supplemental form is usually called cyanocobalamin. As I said before, some people do have difficulty absorbing B12 as it's a two-step process. You need a certain amount of hydrochloric acid in your stomach, and also this intrinsic factor, which is a protein found in the stomach, and that enables them to be absorbed together. Okay. Now, methylcobalamin is the active form of B12, and they first looked at a rat model that showed ultra-high doses of methylcobalamin injections inhibited the progression of motor symptoms. So they started to look at this in our patients. And they did do a small pilot study using ALS patients that showed a lot of promise. After that, they also look at safety. So if we're giving something in a higher dose, we want to make sure that it's safe for patients. So along with showing some efficacy that it works, we want to then look to see, is it safe for our patients? And then when they broke it down into categories, I guess the overall result wasn't as promising, but when they broke it down into different categories of patients that would benefit, they saw that the ones that were treated within the first year of diagnosis and had a specific or moderate progression rate benefited the most from this therapy. So many patients are now on these injections, giving as 50 milligrams intramuscularly 2 times a week. It protects the mechanism, which is very important, that when something works, that we understand that it's a possibility that it could work and that the mechanism is something we understand. It protects the cells. It functions as an antioxidant, as an anti-inflammatory. And then something interesting is that we think it alters the gut microbiome. And I'm going to go into that in a few minutes as well. The other interesting thing I found, which is one study, was that when this is used in combination with riluzole, it appears to have an added benefit. Okay, so this is another promising vitamin, which is nicotinamide riboside, and I'm going to call it NR. And then you'll see what we link it with, and that's even harder to pronounce. But we have vitamin B3, which is responsible for energy production and DNA repair and regulation of inflammation. So what they saw was that this NR was coupled with pterostilbene, which is a different, it's not a vitamin or mineral, it's a polyphenol, but it's widely distributed in foods, and it has antioxidant, anti-inflammatory, and immunomodulatory properties. So this pterostilbene provides greater bioavailability. The pterostilbene links with the NR and actually allows it to cross the blood-brain barrier. But basically what it's doing is getting to the organ that we want. We want it to protect the neurons, and the pterostilbene allows that to happen. So this was studied, and I think they called it BASIS. This was the combination. So I went in to look at this. I didn't find a study with the word BASIS in it, but I did find studies with the nicotinamide riboside and the pterostilbene. They started off, of course, with a mouse model of ALS to see if it would work, testing it. And they did, the study done with BASIS, Dr. Bedlock points out, had a high dropout rate. I guess there was some issues with the dosage that was given. But they still feel that this shows a lot of promise. And so this will likely be something that will be being studied in the future. And what they found that it not only slowed progression in the animal model, but it also showed some actual cognitive improvement. The other thing you may recognize is that the pterostilbene is, or a stilbene, which is a relative of the pterostilbene, is resveratrol, which is that component in red wine that everyone's drinking red wine because they think it protects the heart. Okay. So then I went on to do some of my own research on this NR and the pterostilbene. And I did find one study that linked it with actually a diet. So that made me very happy. It was a very small study. There was only 40 subjects. So they put them in 4 groups, which means each group only got 10 people. They had, of course, a control. They had the antioxidant, which is the NR and the pterostilbene. They had a group of Mediterranean diet, which is supplemented with coconut oil, and they combined the antioxidant and the coconut oil together in the 4th group. And what they really were looking at is we're always looking to maintain weight. That's so important in our patients. We want to maintain their weight. So they looked at their weight. They looked at other parameters of, body muscle and body fat, BMI. And what they found was that the Mediterranean diet that was supplemented with the NR and the pterostilbene, and also the Mediterranean diet supplemented with the coconut oil, had the greatest benefits for weight and other parameters related to body composition. Okay, so while I don't, promote coconut oil because we're still not so sure as far as heart health goes, it is a fat. It can be used in the diet. It's generally not really found in the Mediterranean diet, which has more of the extra virgin olive oils and things. But in this case, it did actually help with body composition. So, that may be something that we, go on to study a little bit further. Okay, so I talked a lot about, or I mentioned the microbiome, but I want to explain exactly what it is because this is another area of research that's very, very interesting. So I just wanted, for those who are unfamiliar, I just wanted to give you some definitions and just a little bit of context. So dysbiosis is the loss of microbial diversity in the gut, and it's correlated with intestinal inflammation and change in gut integrity. Because we eat a lot of processed foods, and over time, this is expected to change based on the food supply, and also people's choices. If you take, I think, a lot of anti-steroidal medications that can disrupt your microbiome. But it's composed of trillions of bacteria, fungi, and viruses, and they live in the body and they play different roles in maintaining your overall health. So we call this the gut microbiome. And recently, reduced bacterial diversity or makeup has been correlated with various diseases. Now, definitely with GI diseases, we look at dysbiosis for conditions like Crohn's disease or ulcerative colitis and IBS as well. But now they're trying to look at this in relationship to things such as Alzheimer's, ALS, and Parkinson's disease. And they have started to link changes in the microbiome and ALS in the, and it's in the early stages, but this is another active area for research. And what they feel is that this may help explain some features of the disease that are not explained by just genetics alone. Okay. So there are several metabolites that are of interest in ALS research, and they may contribute to systemic inflammation and neurodegeneration. And they also said that supplements with vitamin A, but that's a fat-soluble vitamin that we don't want to take too much of. So if you just take a normal supplementation, and the B vitamins, that helps promote a beneficial microbiota in the ALS patient. So taking a multivitamin with some of these, with vitamin A and B might be beneficial as well to have a healthy microbiome. And then I'm going to finish lastly talking a little bit about vitamins and multivitamins and multiminerals. So as it becomes more difficult to swallow and you get very tired during meals, and sometimes patients tell me they rest because they're a little tired and they may keep going after they take a little rest period. Certain nutrient intake kind of becomes inadequate. So we looked at this in the beginning and we saw that there were certain nutrients, like especially protein. If the protein things get very difficult to chew, we can, suggest softer proteins. People can blenderize their food a little bit or chop it up to make it easier. Generally, we want the meals to be under 30 minutes because otherwise we feel like you just use too much energy up trying to get in what you need. So to help bridge this gap, the multivitamin and multimineral is suggested to help meet those requirements. Because as you can see, to have good bone health, to have a good healthy gut, to help you fight this disease, and just to maintain normal blood levels of certain minerals, you need a certain amount. Multivitamins and multiminerals come in liquid, gummies, and I also found a spray for the B vitamins. And so for some of our patients, most of the time I'm talking people into taking a multivitamin, multimineral, but I really talk to the patients about this if they're going to have a feeding tube placed, because we want them to be as well nourished as possible going into the procedure. When we start to refeed people with some tube feeding, sometimes there is shift in electrolytes, or that sodium, potassium, some of the minerals, the magnesium, and so forth, change in the body. And so we want you to have adequate amounts going into it, going into what we call the refeeding period, where we're giving you nutrients via a tube. So it's very important that you're well nourished at that point. Sometimes we also will ask for, more B vitamins in addition to the multivitamin, multimineral, because we do want to protect the heart, since those B vitamins are very important. So usually several days, or if you're not already on a vitamin and mineral supplement, it will be suggested prior to the start of the tube feeding, and probably continued for a little while after that. If you're meeting most of your needs by the tube feeding, generally there's enough vitamins and minerals contained in that you don't need a supplemental vitamin or mineral. And then, because I thought people, I am towards the end, but I just wanted to point out some of my references so that you can see where I got some of my information, especially for some of the ones that are more research oriented. So I did include them there. This isn't everything I used for this talk, but these are the ones that I was talking about, mainly from Dr. Bedlock's Neil's ALS webinar, where he was talking about the pterostilbene and the NR. Okay, so I try not to make this too technical. It's vitamins and minerals, but my passion is food and keeping people well nourished as much as possible. So I thank you for your time. I hope you learned something. And do you have any questions for me?
Lorraine, we're going to start off with one question from the audience. Do you have any thoughts on supplements with Prostat for peg feeding?
So Prostat is an excellent protein supplement, and you can take that. Usually, that's for needs over and above the average. So most of the tube feedings have a certain amount of protein in it that should meet needs. But if you have any wounds, certainly Prostat is something that I believe you can take it orally too. You can. It's very, very sweet. You would have to mix it with something, but you certainly can use that down feeding too.
And Lorraine, I'm going to have you pull down your sharing of screen while we do the questions and
Oh,
answers.
sure.
No,
Sorry.
not a problem.
Um, okay. There we
And
go.
then another question would be, how long are B12 injections recommended to be taken?
Um, I believe it's ongoing. I believe that would be for, I guess, lifelong.
Okay, and is the what would be the interval of injections?
I believe it's twice a week.
Okay, okay. And I have another question from the audience. Which feeding tube nutrition has the most optimal mix of vitamins and minerals?
That's the most optimal. Well, they're all, um, most tube feeding products are supplemented to meet 100% of the RDIs. If you take over a certain amount of volume, so in other words, if you're taking 4 containers of, I'm going to just, one product we use is Jevity 1.5, that actually, you would probably still need a multivitamins, multi-mineral supplement because it's just under the requirement, which would be 1,000 mLs to meet, so that you wouldn't need that vitamin or mineral. I don't know of any one in particular that would have more than the others. What I will say is some of them that are not needed as or not marketed as a full tube feeding product, and I'm trying to remember some of them that are uh, it's meant to just replace a meal occasionally. Those may not have 100% of the RDAs and not meant to be a standalone tube feeding product. But the other ones should have enough vitamins and minerals. Occasionally, something will have not like I'm just going to say Liquid Hope. I think I have supplemented the sodium in that on occasion because it didn't have enough. But I think they've worked to make that better. So you would have to ask your dietitian at your clinic, am I getting enough formula that I would meet what I need?
Okay, very good. And another question would be, what is the good of CoQ10? Q10?
So, so CoQ10 has been studied, and I don't believe they're going to continue to work on that because I don't think any of the studies really showed efficacy for super supplementing that for ALS patients or supplementing it at all. Now, I know some people do take CoQ10 if they're on a statin for heart disease for their elevated cholesterol. So it's not going to hurt you, but I don't think there's going to be any more studies done on that because I don't think they saw anything that was worthwhile.
Okay, and additionally, are there supplements with creatinine recommended for ALS?
So see, that's another one that is on the list of, and I had one patient that took this and continued to exercise, and he did real well on it. But for the larger studies, and I'm just looking for my list of ones that Dr. Bedlock said we're not going to really continue to look at. That one also, they're not going to continue to look at that with ALS as being a treatment.
Okay, I have a participant asking about the B12 again. They're taking 2 shots twice a week. Is that variant to most people?
I believe it's separate. So it's 50 milligrams, I think IM 2 times a week has been what I saw in the literature. And I think what's generally recommended at our clinic. So I'd have to know the amount. Um, the other, the other thing I guess I would also want to know if they would be 12 deficient.
Right. Okay. We'll have to,
That may
they can
make
talk that with their dietitian a little bit more.
or ask their neurologist.
Right. Okay. I'm exercising twice a week, but can't consume more food. But I feel full. What do you suggest so I don't lose more weight?
So generally what we suggest is smaller, more frequent meals in that case, because the early satiety is something that happens with our patients. We also feel like your stomach slows a little bit, so you feel full most of the time. So I would say do some very high calorie snacks in between meals. And if you're exercising, of course, protein. Some of the things I recommend, and I always hate to give a brand name because it looks like I'm favoring that, but the what I always say is the biggest bang for the buck is um, the why is the name going right out of my head? So K Farms has a product that's very high in calories. I think it's 500 or 480 calories, but that's in 11 ounces. The very high calorie boost is the one I very often recommend for my patients because in 8 ounces you get I think 20 or 22 grams of protein and 500 calories. So even if you split that up, had half in the morning and half in the afternoon, you're putting 500 calories in your diet and a good amount of protein. So very high calorie boost, or look for something where it's about 500 calories in the serving size, and that has some protein in it. And that's what I would recommend.
Okay. And at one time, turmeric was recommended and also suggested by Dr. Betlick. Where do we stand on turmeric these days?
You know, I want to find my list because he had a list of things. I think he had a form of turmeric on that list. So I didn't specifically look at turmeric, but I also didn't see anything where that was one that was, I know it's implicated in decreasing inflammation. So, but it's not something that I saw a lot of research on currently. I think that's one that we're maybe shying away from a little bit. So they're really trying to put, I think, the research and the into things that they, has a mechanism and or things that they know that they've tried that they do think will work. So they can't, continue to look at everything, but they're trying to target some other things.
Okay. And we had a little more information on that original B12.
Mhm.
Basically, it was going to be 25 milligrams per injection,
Okay.
and 50 milligrams was too much to inject in one location, as per the pharmacist. So
So
that,
they're giving you the same amount, they're just breaking it up into different doses.
right, right. So they
Okay.
give a better clarification. Let me just see if we have something additional.
Oh,
Okay, I think that's kind of what we've already now received. Let me just look at them one last time.
let's see.
And maybe we could just address with ALS patients, it's been noted that their metabolism can be higher. And again, that would be one of the foundations, I would presume, for the uh, formulas that are recommended, the
Mhm.
two feedings, and then the supplements along with it. Any further comments on that?
So usually we put people on there's all different formulas out there. There's even 2 calorie per ml formulas, but I worry about dehydration in some patients with that if they don't provide adequate water. So generally ours are nutrient dense. They're 1.5 calories per ml, which means that, so you don't have to take as many containers. So if someone had very high needs, I might consider doing the 2 calories. This way we could cut down on how many feedings they would need in the daytime.
Right. And for those patients that have opted out of a feeding tube and we still want to try to assist them through their cycle of their journey with good nutrition, hydration, are there any recommendations that you can say are the best pointers for maximizing when people are unable to take in large volumes themselves?
So that's when we really do the smaller, more frequent feedings so that you can take in throughout the day. Then patients tell me it feels like they're just eating all day. But that is like the best way to do it is to have small amounts, keep some snacks next to you so that you can keep eating. As far as hydration goes, I would say keep a water bottle near you with a long straw if that you need that, or whatever you need to, so you take sips frequently throughout the course of the day, because hydration is so very important to keep your secretions thin, just to hydrate your muscles. So it's very, very, very important to hydrate well. Trying to think. So Dr. Lee at Columbia did a study, and what he found with, I think, Dr. Schneider, was that they looked at the different diets of patients, and it doesn't matter. I'm a whole foods approach person, so I like to see people eating healthier foods. And some people also do that, so we honor that. But a calorie is a calorie. And so what they basically found was that people that eat, I think, French fries and macaroni and cheese, which also has some fat with it, but maybe not necessarily carbs we think are so wonderful, but they maintain their weight better in the ALS population. So we need to focus on calories and getting adequate nutrition in, certainly protein. You certainly can put some of the other things, like you can add some fresh vegetables to your smoothie and blend it up if you need to. But basically getting in, even if commercially prepared foods, even things that are not really the whole foods approach, they are very important because they do contribute calories. When you think about macaroni and cheese, it's an easier thing to eat and it's so high in calories. So those are foods that I would encourage. I encourage whole milk. I encourage putting olive oil or some spreads on things, because it makes it easier to swallow them and chew them. And it gives you good calories that you need. So make every bite kind of count for something.
Very good. I think we've covered most everything. We've gotten all the questions from the audience. I'll ask if anyone would like to put an additional question in the chat while we have time.
Okay, and I'm still trying to get the answer on if the B12 injections are lifelong or not.
Okay.
I'm working hard. Uh, okay.
Okay, I see no other questions coming through. Definitely, speak with your clinic team about your nutrition needs, about how you're tolerating formula as you either have a tube or not, or your swallowing abilities are changing. Always good to keep them informed. And again, if there's questions or things that come up before your 3-month intervals, it's always good to give the team a heads up of changes that are no longer just isolated, but appear to be becoming more of a regular occurrence. And I want to thank Lorraine for giving us tons of information that were very valuable, and the contributions of diet as well as the supplements. And thank you all for joining us. I want to let you know that we will be having the next session. It will be focusing on the understanding of the psychological and emotional aspects of living with ALS. Two presenters will be from Columbia, Martin McElhaney and Rachel Brody. So I ask you to stay tuned and join us for 1:45 and join us for that next session. If you're not registered, there's still time to do so. And thank you for joining us today. Lorraine, thank you for being our guest, and we look forward to having future meetings and topics and discussion.
And I do have a high calorie cookbook. If anybody desires it, just let Bob know, and I certainly can send it on. And thank you.
Thanks so much for joining us. It's been a pleasure having you, and continue to enjoy the summit with us. Thank you.
Bye-bye.